Hello, I am Christophe Weber. Thank you for joining me for an update on Takeda full year 2019 results. Since we announced our last results, the COVID-19 pandemic has claimed many lives, despite the remarkable efforts of physicians and healthcare workers around the world. Global economies and healthcare systems face a crisis unimaginable just 1 year ago, and our thoughts are with all those affected. Today, in line with our values, Takeda is taking a leading role in meeting the challenges of the global pandemic. First, we have been able to maintain the supply of our medicines to patients across the world while keeping our employees safe. We are also identifying and developing potential treatment for COVID-19 from within our R&D pipeline and plasma-derived therapies. We have already initiated the development of a plasma-derived therapy with the potential to treat people with serious complications from COVID-19. Instead of working alone, we started a collaboration with other companies called the COVID-19 Plasma Alliance. So we'll work together across areas such as plasma collection, clinical trial development, and manufacturing to make an unbranded product so that more COVID-19 patients can potentially be treated and treated sooner. If successful, the COVID-19 immunoglobulin can be one of the earliest approved treatment options. In 2019, we accelerated Takeda's transformation into a top 10 global biopharmaceutical company and delivered another set of excellent results, positioning Takeda for long-term success. We are now operating fully as one Takeda. Let me now comment on our fiscal 2019 results. I am pleased to report that we delivered our management guidance. Revenue were 3.3 trillion yen, or $30.2 billion, a 1.6% increase over last year. Our performance was driven by our 5 key business areas, which represent 79% of total revenue and grew 6%, as well as our 14 global brands, which were up 22%. Underlying core earning margin reached 28.9%, benefiting from cost synergies and OPEX efficiencies, and underlying core EPS was 395 yen. And we were able to report strong reported operating profit and reported net profit 1 year after closing. In addition to meeting our earning targets, we made excellent progress in 2019 towards achieving our other important financial goals, including divestiture, paying down debt, and accelerating cost synergies. We ended the year with a net debt to EBITDA ratio of 3.8, down 4.7 a year earlier. We delivered strong cash flow and ended the year with liquidity of over $20 billion, which gives us great confidence in our ability to meet our financial commitments, even in times of economic uncertainty. Innovation, global scales, and successful integration are a powerful combination with the potential to deliver some of the best margins in our industry over the medium term. Our R&D engine to deliver life-changing medicines is focused on 4 therapeutic areas: oncology, rare disease, neuroscience, and gastroenterology, plus targeted investments in plasma-derived therapies and vaccines. As well as expanding opportunities for our 14 global brands, we have 12 potential first-in-class or best-in-class Wave 1 new molecular entities that could be approved over the next 5 years. Furthermore, our long-term pipeline will be sustained by 30 Wave 2 assets in the early stage of clinical development, as well as our ongoing investment in innovative platforms such as cell therapy and gene therapy. All of this is underpinned by our growing reputation as a partner of choice with 38 new R&D collaborations with biotech and academia in 2019, adding to the more than 200 partnerships already in place. We want to ensure sustainable, profitable growth by focusing resources on our 5 key businesses and 14 global brands. Takeda's geographic footprint is now increasingly aligned with global growth opportunities. Our scale and product portfolio strengthen our competitive position in key territories like the United States, Japan, Europe, and growth and emerging markets. As one Takeda, we drove a significant improvement in profit margin this year, and we have raised our cost synergy target from $2 to $2.3 billion by March 2022. We'll be able to use these incremental savings to reinvest in our growing business while still striving to achieve our margin targets. And by maintaining financial strength, we can reward our shareholders and continue to invest in long-term innovation and commercial success. Looking ahead, we expect our growth momentum to continue with low single-digit underlying revenue growth, high single-digit underlying core operating profit growth, and core EPS growth in the low teens. We believe that our portfolio of life-transforming therapies, which are not affected by elective procedure, will prove resilient to the COVID-19 crisis. Of course, there is still a great deal of uncertainty, and we'll continue to carefully monitor the situation. We also intend to maintain our well-established dividend of 180 yen per share. As a values-based, R&D-driven company, Takeda is well positioned to succeed in a changing environment, which requires pharmaceutical companies to combine innovation with the ability to ensure the widest potential access for patients. I would like to end by thanking our employees, our partners, our shareholders for helping us to accelerate Takeda's transformation and enabling us to meet the current challenges that face us all. We look forward to continuing to deliver a better health and a brighter future for the world. Thank you very much.